Talk is a component of what I do. It's important, but it's not the end-all be-all. Hi, my name is Liz. I am one of Nirvana Calgary's certified trauma coaches. So in my experience, I find that purely talk therapy has left us feeling quite raw emotionally. And what I've done is combine a few other techniques as a way to reground, help to process in those moments and integrate those experiences so that you can leave the session feeling ready to handle the rest of your day. One of those techniques is rooted in my background as a registered yoga therapist. I pull on the mindfulness-based stress reduction techniques. Oftentimes you'll hear guided relaxation techniques, guided meditations, biofeedback in the form of heart rate variability training, or even just guided breathing techniques. Any of those fall into the category of mindfulness-based stress reduction. So one of those techniques, after a particularly emotionally raw session, we spend the last few minutes or however much you need in that type of guided practice. Typically after that, I find that my patients are feeling ready to go and ready to tackle the rest of their day. Another technique that I utilize is auditory bilateral decoupling. Basically, it is a specially composed piece of music that shifts from the left to the right ear. So it actually moves. You can hear that movement from the left to the right ear. And as that music plays from the left to the right, we're actually hacking into an innate process called our orientation reflex. And it allows us an opportunity for the limbic, that emotional brain, to be able to soften and lean into the existence of that emotionally raw experience. And when we do that, we're often left feeling that memory itself is not so emotionally charged anymore. We're left with the memory itself and not the emotions that we felt maybe at that time or how they have compounded over the course of our lifetime. People come to see me because they feel rooted, they feel stuck, they feel like they are repeating the same narrative, the same patterns from their past over and over. So this is in part due to our limbic system. Our limbic system is a series of brain structures. One of the key identifiers in there is something called our amygdala. Now our amygdala is essentially our threat detection system. So it assesses situations and experiences and catalogs them as either safe or dangerous. As you can imagine, those initial novel experiences, we can't be certain that the amygdala cataloged those in the beginning appropriately. When we experience that mismatched information, it sounds the alarm, potentially at inappropriate times. And so if that alarm system becomes tripped for non-dangerous experiences, we find ourselves being constantly triggered in our day-to-day life. Sometimes it looks like anxiety, sometimes it might look like depression, even chronic pain. Oftentimes that nervous system has immobilized because we're not sure of the safeness of our environment anymore. By addressing that amygdala and addressing how it's been cataloging information, and allows us to decouple how the amygdala may have inappropriately cataloged those pieces of information earlier in life. But ultimately we need to know what we're dealing with. So talking about those childhood experiences is important. If anything that I've discussed today resonates with you or with a loved one, don't hesitate to visit our website, www.nirvanahealth.com, and visit the Book Now button. A 30-minute complimentary phone consult is available to you.